Good evening, everyone. Welcome to session 2 of NEET UG Counseling Guidance 2022. Hope you already seen the session 1 video where we elaborately discussed about the UG counseling process, do's and don'ts. In this, we'll go a little bit about how to choose a particular college on your ranking, what is the competition out there in the field, and what all the components you need to see in this entire counseling journey. So, moving ahead, today we have the panelists Dr. Wasim, Consultant Surgeon, Bangalore, is UG from SV Medical College, Tirupati, Andhra Pradesh. Dr. Pallavi, Consultant Pediatrician, Mysore, Hassan Institute of Medical Sciences, Karnataka. Dr. Syed, Resident Physician, Mysore, Kasturba Medical College, Manipal, Karnataka. Dr. Naveen, Consultant Oncosurgeon, Mysore, Mbbs, Bellary, Karnataka. Dr. Rishan, Resident Pediatrician, Mysore, Mbbs from Stanley Medical College, Chennai. And the counseling expert, Mr. Kumar Madhav, with 12 years of experience. Moving forward ahead, today's agenda for the session is counseling timelines, the statistics, very important statistics, then the components of choosing the college, the nature of MBBS, how impactful it is while choosing the college, then the post-MBBS scope which should be considered while choosing your college, then the transition from the school to college, and finally the need for the right counseling guidance. And myself, Dr. Sridhar, and thank you for inviting me for moderating the session. And the NEET Predictor team, once again, for making this event possible in this need of the hour. Moving forward with the counseling timelines, I would like to call Dr. Wasim to talk about the timeline of round 1.
Good evening, everyone. Welcome to today's session. So, hope you already have seen the session 1. We have discussed few very important things there in the session 1 as well. If you haven't seen, we'll drop a link down below. You can go and see the session 1 as well. So, coming to today's session, we'll start with the timeline. So, counseling timelines. You can see it is displayed over the screen right now. So from 11th October to 17th October, there will be registration. Okay, you have to look at the words written in the red as well, because up to 11 a.m. as per the server time, it is also important, because whenever you are seeing the dates, you should see time as well. Okay, and then the payment facility will be available up to 3 p.m. of 17th October as per the server time. So this is the period for registration and payment for the counseling. Then choice filling starts from 14th October to 18th October up to 11:55 p.m. Okay, and choice locking will start from 3 p.m. to 11:55 p.m. on 18th October 2022. Okay, and then after that, the verification of the internal candidates by the respective universities will be done from 17th October to 18th October. Processing of seat allotment 19th October to 20th October. Result will be tentatively reported on 21st October 2022, and reporting will start from 22nd to 28th October. And below you can see the number of days allotted for the respective category, like registration payment for 8 days, choice filling 5 days, verification for 2 days, processing of seat allotment is for 2 days, result will come on 1 day, and reporting the time is given for 7 days. So it is very important. This timeline, please keep in line, because the first round of counseling is going to start soon. Yeah, over to you, Dr.
Thank you, Wasim sir. Actually, for counseling, the timelines are very, very important. When the people would have followed other exams also related to medical counseling PG, there was a delay of more than 1.5 years due to COVID. Then even this year, so much delay is happening. Because this is the exact reason why we need to stress more on the timelines. So I would like to call again Mr. Kumar Madhav, who is a counseling expert by himself, who has guided more than thousands of candidates over these years, both for UG, PG, and other graduate courses as well. Your opinion on the round 1 timeline shift? Is there a possible shift going to happen this year, or it will be like same as this tentative schedule? As well. And also you can add a few about the rules of this counseling process as well.
Yeah. Hi everyone. Good evening. Myself.
Your voice is a little bit low.
Yeah. Is it audible?
Little bit more. It will be fine.
Yeah, hi. Myself Kumar Madhav. Like I'm a counseling expert. So let's talk about the dates and all, and the rule of all India registration process, how to do the choice filling, how to do the registration, and what are the factors we have to see over here. So if you'll see the registration as per Dr. Wasim sir, registration date, they have already given a registration date and it's a tentative date. So mostly we are expecting same date. Like maybe the counseling is going to be registration is going to start on same date, like 11th of October to 7th of October. So candidate they must note the registration date and choice filling date, it's from 14th to 18th of October, and choice after registration we can do the choice filling till 18th of October till night 11:55 p.m. And this panel they takes around 2 days to 3 days to process the result. So result is expected to come on 21st of October, and from 22nd to 28th of October, they need to go offline for reporting. If some candidate they're getting a seat, so they must need to go to the college and report offline, because reporting process is not a online process, it's a offline process. Registration, choice filling, everything we can do online apart from reporting. So let's talk about the registration process. So registration process means basically we need to fill some details regarding details the name, roll number, email ID, contact number, and all. And after that we have to choose the subject and types of quotas and all. So subject means MBBS, BDS, BSc nursing. From past 2 years they have added BSc nursing as well. So after choosing these quotas and all, subjects and all, we have to choose quota. That they do have different quotas, 15% AIQ, and apart from this, they do have Central University quota, like ESIC, Delhi University, Indraprasth University, and different quotas. And apart from this, we can choose Armed Force Medical College as well. So for Armed Force Medical College, at the time of registration, we have to select the tick button over there, and for Armed Force Medical College, we have to apply separately as well. So it's not like that we are applying for all India quota and automatically they will be calling us. For Armed Force Medical College, we have to apply separately through their website, Armed Force Medical College website. So these are the registration process. After registration, we have to pay the security amount. So security amount means round one is the free exit. So if we are doing the this thing registration in round one, then we not need to pay the registration amount or security amount for round two. So if we are joining if we are joining a seat in round one, or else if we are not joining, if we are not allotted a seat for round two, we not need to re-register again. But if you are joining, or else if you have been allotted a seat in round two, and if we are not joining that seat, then that security amount will be forfeited. And in that condition, to if you want to participate in mop-up round, then again we have to re-register and we have to pay that security amount. So the candidate, whoever are opting for deemed university, they must be aware of this thing, security amount, because in deemed university we have to pay 2 lakh security amount. So these are the basic registration security amount process. And let's see the this thing MCC, which all types of quota or which all types of the colleges it comes under this MCC counseling. So they do have 50% all India MBBS and BDS seats in government colleges. Apart from this, they do have BHU open quota seat, AIMS, JIPMER, Aligarh Muslim University. So and 85% internal quota for DU Indraprasth universities. And apart from this, they do have 15% all India quota seat for ESIC insured person. And Armed Force Medical, they are only just taking the registration. And apart from registration, if you want to apply for Armed Force Medical College, then we have to attend separate counseling for that. There will be some interview and some physical fitness test and all. So we have to go through that. And apart from this, deemed universities, 100% seat, it comes under MCC counseling.
Yeah, thank you, Madhavji. So basically, when you are going for counseling, people should be aware of what all the options available first. That is the far most important in all the aspects. It is that people will usually think, as for UG is concerned, they want to retain themselves in their own state. But they should understand that there are so much options out there that can be availed in the All India quota as well. For UG, people take state counselling as their primary factor. That can be, but still, the All India counselling starts earlier to the state. So it will be much better for them to understand on what is important on them, what all the options are available before making the informed choice film. So again, I would like to call Dr. Wasim to cover a little bit about this MCA counseling quotas, particularly to the 15% of all India quota seats pertaining to all the states.
Dr. Sridhar, as you can see over the screen, it is displayed that MCC, it is a counseling body which conducts the counseling for a specific set of seats. Okay, for example, there are 100 MBBS seats available in government medical colleges. For example, out of them, 15% of seats in that state will go for All India, because when a state is participating or contributing its seats to All India, then it gets a chance that those are the students who are domicile of that state, they also get to participate in the counseling, and they also compete for the 15% of seats of all the other states in country as well. So that is the important thing to be noted here. So 15% of seats in that state will go into All India quota pool, and rest of the 85% seats, those will be filled by the respective state counseling. Okay, and as well, in All India quota, as Mr. Kumar Madhavji has told, deemed universities are also covered for the counseling process. So this 15% thing, previously Jammu and Kashmir was away from that. But Andhra Pradesh was also away from that. Telangana was also away from that. Slowly, all the states in India have come into that pool, and now wherever you study, whichever domicile your state may be, now you are eligible to compete for the 15% of All India quota seats all over the India. So that is the main thing regarding this 15% of All India quota. Over to you, Dr. Sridhar.
Thank you, Dr. Wasim. So moving forward, we have this round 2 and round 3 schedules, which have already been tentatively scheduled. You can see the counseling process goes well into the month of December as well, the final online entry. So till then, the game is not over. That is what we're trying to iterate here, because this is like a journey of your life. You should dedicatedly involve yourself in assessing each and every options, whatever you're trying to put in the counseling process. We are trying to cover it as broad as possible so that you understand a bird's eye view of what all the things available. Then we will subtly guide you like what is the next steps to carry out with the choice value. Because a subtle change in the number, whatever you have got, can make a dramatic difference in the counseling process. So moving on a little bit of statistics to understand the depth of the counseling's importance. You might already see this is from the National Testing Agency's report. Total, if you see, there is a tremendous increase in the number of people appeared for NEET UG 2022. Almost it is like 18 lakhs people. In that appeared is 17 lakhs 0.5. Then qualified is almost 1 lakh. If you really understand and go into the numbers, before appearing to the exam, when you are in the preparation phase, you are facing a competition of 1:20. This number is very, very important, because out of 1:20 candidate, there is an opportunity to clear or qualify for the exam. And you're already into the stream and you're selected. Congratulations for that. Now, moving to that, we want to say one ground reality as well. So there are 10 lakh people post-exam who are eligible, but the number of seats available is 1 lakh. It is not that just from rank 1 to 1 lakh, everyone will be taking out. So many parameters will be involved in this. So that is what we try to give you here. One is the quota reservation. Second is your domicile state, your native state or language barrier. Then more importantly, government or private institute or deemed institute, whichever you're choosing. All this makes a difference that all the band, the first 1 lakh will get dispersed to even 1.5, even 2 lakhs. So this is where the real thing comes. Even it is not that the people who are not in the competitive area need not apply for the counseling. Everyone who are eligible are eligible to apply for the counseling. They can get well oriented towards themselves, like what is the counseling process and those on. if somebody did not get their preference on the round one or whatever it is, they can pursue that. Even they want to repeat the exam over next year, they will get to know the exact process, how it is going on. So this is the post-exam competition ratio of NEET UG. Still little bit want to give a bird's eye view of how it will be happening as well. I would like to call again Dr. Wasim sir to understand the depth of competition really that exists in the counseling process and the post-counseling process.
Yeah. See, actually, like Dr. Sridhar has mentioned here, this ratio is just to tell that if 10 aspirants are there for an MBBS seat, one person will be able to get an MBBS seat. So that is the high level of the competition. So the qualified candidates and the number of candidates who can get MBBS seats. So there is a huge tough competition, and as well, and there are other categories as well. You have government medical colleges, you have private medical colleges, you have deemed medical colleges, and again in private medical colleges you do have categories like B category, you have NRI quota, you do have management quota as well. So all these categories, when segregated into the picture, the main important thing is to secure an MBBS seat, you need to qualify your NEET UG entrance examination. So first of all, you have qualified your NEET UG entrance examination, you are into the race now for an MBBS seat, and where do you stand? And regarding, and you get tailored to your needs. Like for example, if you are looking for a deemed university, okay, so your rank may be around 50,000, 60,000, 70,000. So at your rank, if you are looking for a good deemed university, yes, there are heavy chances that you can get a good deemed university as well. So it's a point like you should never lose hope. There is always a chance for everyone, and you can always get an entry into a medical college with whatever the criteria I have explained to you. It's not only about government medical colleges. MBBS course is conducted in private medical colleges, deemed universities as well. So there is a broad perspective for that, and you need to tailor yourself and fit into that perfect picture where you are going to land in for your next 5 years of your MBBS course. So here where the importance of the correct counseling guidance comes into picture. So when you have a rank with you, now that you need to get a proper guidance where to settle. So at your rank, which college is best, which college is probable for you to enter, and all those things based on the parameters, when it is calculated properly, you will end up in a very good place for your particular rank, whichever rank you are holding in NEET UG. Yeah, over to you, Dr. Sridhar.
Thank you, Dr. Wasim. Now we'll go a little bit about the colleges in general. I would like to call Dr. Pallavi Madam, consultant pediatrician, to explain a little bit about the counseling states with the number of colleges.
Yes, Sridhar.
Over to you, ma'am.
Good evening, everyone. Congratulations again. And counseling is about to start now. So you all should have a clear idea about what you'll be opting. There are 1 lakh seats. There are total of MBBS. The seats are 1 lakh. As Dr. Wasim and Dr. Sridhar said, you are in the competition of 1:10 now. So there are so many factors you should consider while choosing a MBBS seat in a particular college. Now, because especially you are from a state where you are having a few medical preferences. In case if you don't get it, when you want to opt for the other states, there are especially there are 15 states in India which are having medical colleges of more than 15 in number, like 50, 60 colleges are there. So always it is better to opt for a state where there are more medical colleges, because that will help you all in your PG the preparation, when we are taking a PG seat. Example, there are few states, as you can see in the screen here, like Andhra Pradesh, it is having 31 medical colleges. Telangana is having 32 medical colleges. Karnataka is having 33 medical colleges. Andhra Pradesh is having 34 medical colleges. Telangana is having 30.
Hello, ma'am, are you audible? I think there is some connectivity issue. So I would call Dr. Wasim to take over this part for Madam. Yeah.
Yeah. See, the point is, ma'am, members continuing here, it is very important that there are multiple states where there are heavy number of medical colleges available. So here you can see the total number of colleges are seen in the slide now, and we have total government seats available in that state as well as total private seats. It is very important that where you are going to do your MBBS, because if there are heavy number of medical colleges in that particular state, it means that that state will also have adequate or comparatively higher number of postgraduate seats as well, because your journey starts with MBBS, it doesn't end there. There's a lot more further as well. So after your MBBS, you need to do your specialization as well. Few people aim for super specialty as well. So it is always important, because when you are going for your postgraduate specialization, it is always important because the domicile state. So for now, where you have studied your +1, +2, and all those things come into picture for your MBBS state. But for postgraduate, NEET PG, where you do your MBBS, that will be counted for your domicile state for postgraduate counseling. So it is very important that when you are selecting when you have an option to select, please select a state where you have a large number of medical colleges, so that when you do MBBS from that state, you will have a better scope or will have a wider opportunity to get into postgraduate seat easily, because there will be adequate number of postgraduate seats as well in that state. So here you can see in the slide, Andhra Pradesh has 31 colleges, 31 medical colleges, and out of them around 2,400 are government colleges and 2,800 are private colleges. Okay, and the similar way, if you see, Karnataka is topping with 63 medical colleges. So if you do MBBS in Karnataka, it is obvious that there are 63 medical colleges there, and around 80 to 90% of them already have postgraduate course also in those medical colleges. So it is quite obvious that if you do MBBS from Karnataka, you will get a better opportunity for postgraduate seats as well in that particular state. But as I already told you, MCC is conducting for all India 15% quota seats. Similarly, for postgraduate also, MCC conducts for 50% of quota seats. So, but what we have to see is the opportunities become better when you select a state where there are more number of medical colleges.
Yeah. Thank you, Dr. Wasim sir. Actually, that what you told is very, very important. When we go for undergraduate in one particular state where more number of colleges are present, indirectly means the health infrastructure in the state is very better, especially for the medical education level. So the postgraduate seats also is more. So when the same candidate from another state joins in a state with having a higher seats, they are more opportunity to get into the PG course as well. That is there. In that part, since Mr. Kumar Madhav is a counseling expert dealing with the PG as well, what is your opinion and take on that when you see a candidate taking from another state to your one particular state where there are more seats and the same candidate joining for a postgraduate? How best it will help them?
Yeah. See, actually, as per Wasim sir, he explained very nicely. Like the Andhra Pradesh, they are having 31 colleges. So, and if you'll see, if you'll compare, for example, if you're taking Jharkhand with Andhra Pradesh, we're comparing these two states, or is Jharkhand with Karnataka. So, candidate, for example, one candidate is there. He has done his UG from Jharkhand. In Jharkhand, we are having, if he or she is looking for government college, then in Jharkhand, we are having only two options: MGM, Medical College, and RIMS. And same candidate, at same rank, some candidate, he or she has joined a seat in Karnataka. And they are having if you see the total number of colleges, then it's more than 40 colleges. So they are having 40 colleges options. If you'll see this thing, PG reservation, then they do have 50% state quota, government seats. So if you see in Jharkhand, then in two colleges, max to max, they're having 100, 200 seats. It depends upon subject. And if you see in Karnataka, then they're having more than 5,000 seats in government college. Out of which, if you calculate the 50% seat, then that same candidate who has done UG from Jharkhand, he or she is having option for only 50 or 200 seats. It depends upon branch. And his friend or someone is if he or she has joined in Karnataka, then in PG they're having option for more than 2,500 seats. So obviously the candidate, whoever has done their UG from Karnataka kind of states, they are getting more opportunity, and it's easy to get top clinical subject through state quota.
Thank you, Madhaji. Actually, that's what the impact of taking a seat is. It will be forever. That is what the new UG counseling is not that just you are planning for the next 5.5 years. It is even after that. Your decision making process starts even now for the post graduation, because you know the medical education is not just an end course where it is just a beginning. There is a tremendous journey of 10 years over in the medical education where you have to do your post graduation and super specialty. So moving forward with a little bit of states, I would like to call Dr. Syed to cover the other states as well and to add the points which have been missed. Yeah.
Thank you, Dr. Sridhar, and I really thank Dr. Sridhar to inviting me in this session. And I would like to again congratulate the NEET UG aspirants who are opting for MBBS in their as a career in the future. Now there have been a lot of talks regarding the states which you have to choose where the MBBS seats are more. Yes, that is true that it'll help you in the PG and for the future because you will get the state of your own domicile. But the most important thing is you're spending your 5.5 years of life in that particular state, in that particular environment. And the state with most number of medical colleges, you will see people and the students going around from different areas of the country. So you will have better exposure because once you join the medical college, it's not just about your studies because you will see your life in a very different manner. Because you have come from 11th and 12th where you study basic sciences, and then you have jumped into a career-based course. So everything, the state, the study, the college, everything is very well mattered here. So let's go on to what our dear colleagues have already told, that you can see the other states here, like northeastern states also, they have comparatively less medical colleges, and hopefully they will increase the number of medical colleges in the coming times. And some of the states like Tamil Nadu, especially Tamil Nadu, they have very good number of state government seats, where it counts around mostly 5,000 odd seats, and then private seats are also almost 5,500, and total number of medical colleges around 70, which is a very tremendous amount. So states with higher medical colleges will give you a better exposure, not just because of your study oriented, but also your life oriented. Because in the meanwhile, you have to spend nearly 5.5 years of life there. You have to learn, you have to earn, and you have to get back to your career and your life.
Yeah, thank you. Thank you, Dr. Syed. Moving forward with a few other example of top 20 government medical college. Again, I would like to call Mr. Kumar Madhavji to give in overall view of how the coaching process or how this ranking should be calculated, or even how this preference order in general.
See, actually, in this order, we have not added AIMS or it's like JIPMER kind of institute. So these are the top government medical college. So we have to follow the candidate, whoever are having good rank. So they must follow this order. So this is based on the quality, and while choosing the college, we have to see lots of factors. Like if you'll see the number one college, apart from AIMS and JIPMER, as I told, so Maulana Azad Medical College, they don't have bond. So first of all, while choosing the college, we have to see the bond, and we have to see the last year closing rank as well. And candidate, whoever are having their category rank, so they have to see their category as well. So for example, some candidate he or she is having 20,000 rank, or is 15,000 rank. And if they're focusing on colleges like Maulana Azad and all, so it's not the perfect way to do the choice filling order. They can put, but they have to be very practical, that based on her or his rank, whatever colleges has been allotted in last few years. So they have to follow those data, and they have to see the colleges and all. So see, if you see the top 20 government medical college apart from MIMS and JIPMER, then Maulana Azad, it's the topmost college, and it's situated in Delhi, and the last year closing rank was 87. This is the general category rank. and second college is Vardhaman Mahabir, and last year closing rank was 143. Then Dr. RML Hospital Delhi, and their closing rank 258. Government Medical College Chandigarh 455. Lady Harding New Delhi 579. Dr. Baba Saheb Ambedkar Delhi like 621. BJ Medical College Gujarat 721. SMS Jaipur 731. Madras Medical College Chennai 755. So first of all, we have to see the state quota as well. For example, if you are opting for colleges which comes under DU or IPU, then they do have internal quota. Or it's like any other like central universities like BHU, Aligarh Muslim University, or is ESIC, and also they do have central quota. So we have to see that central like internal quota as well. So that will be giving benefit while doing the PG. And apart from this, if you'll see the top 20 private medical college, then CMC Vellore is the best private medical college in India. And next best medical college is KMC Manipal. CMC Vellore, for CMC Vellore, we have to apply through Tamil Nadu State Counseling under this management. KMC Manipal, like it comes under deemed university, so we have to apply through All India MCC Counseling. Amrita Kochi, it comes under deemed university, and we have to apply it through All India Quota Counseling. St. John's Medical College, Bangalore, it comes under Karnataka State College. And St. John's and CMC kind of colleges, they do have like some Christian minority reservation. So candidate, if they are having some Christian minority reservation, for example, St. John's, they are having Roman Catholic reservation, RC1, RC2, RC3. So you must go through that details, and if you don't have that details, you can contact me. And apart from this, Sri Ramachandra Medical College, it comes under deemed university. JSS Mysore, it's a deemed university. It's a 2,200 bedded hospital. So you must, like candidate, if they're getting JSS Mysore, Ramachandra kind of colleges, they must opt for it if they are able to afford the fees. So deemed university, obviously their fees is little bit higher. And apart from this, if you'll see DY Patil, Kasturba Mangalore, KLE Belgaum, and SUM Medical College, SRM, this comes under deemed university, and you can apply through All India Counseling. And MS Ramaya Medical College, it comes under Karnataka State Counseling. So for state colleges, like candidate, like few states, those are open. So like Karnataka is an open state. So other state candidate can also apply for it. So you must know the rules, how to apply.
Yeah, thank you, Mr. Madhav. So moving forward to know about the right components for choosing the college, a little bit were discussed already in the YouTube sessions, as well as some video was given in our channel as well. You can see those videos. Similarly, to brush up those things, we'll again move forward the main components of choosing the college. I would like to call again Dr. Wasim to understand about the main components in choosing.
Yeah, Dr. Sridhar. Actually, so the main component where you are going to select which medical college you want to enter to do your MBBS is, it is categorized into government college, a private medical college, or a deemed university. So this is a broad classification. So in government college, you do have central universities or central institutes like All India Institute of Medical Sciences and JIPMER as well. And you have state government medical colleges as well. And you do have private medical colleges, like already a list has been explained by Mr. Kumar Madhavji, where you have top 20 private medical colleges also, which are actually good institutes. They have a very good academic excellence, and they have a lot of research value as well. So when you come out of as an alumnus from those medical colleges, you do have an international reputation as well. So for example, if you say you did your MBBS from CMC Vellore, you did your MBBS from Manipal, you did your MBBS from, for example, you did it from St. John's, Bangalore, you do have, so there's a small thing here. So whatever MBBS college you are doing, your like medical college you are doing your MBBS, that will become your alumnus for your whole life. So it is very important that where you enter, you put your first step. So I always repeatedly tell whenever possible that a well begun task is always half done. So begin a task well, the task is already half done. So please keep this in mind. So the main component is government or private. In government, you do have options of central and state. And in private, you do have private state medical colleges or deemed universities as well. Over to you, Dr. Shida.
Yeah. Yeah, thank you, thank you. So, keeping this main component in mind, I would like to call Dr. Pallavi Madam to discuss about the sub-components in categorization the main component while filling the order. Yeah. Then how important is to fix your alma mater for rest of your life. For the rest of your life, you'll be there in a separate group. Even you complete your super specialty and go abroad, do fellowship, even practice there in European countries. Still, you are the alumnus of one particular UG college. You'll be called as the particular candidate. So, how does it matter?
Yes, Sridhar. There are other components as mentioned here, like the popularity, as Dr. Wasim said. If you are doing MBBS from KMC Manipal or CMC Vellore, it's a St. John's, those are all like international recognized things. So you'll be apart from your school where you have studied from 10 to 12 years, this is the longest period of your education, about 5.5 years. So whatever you do now, these friends or these years, you're going to cherish your lifelong. So you should choose it very wisely. As you said, it is 1:10. They are in the competition of 1:10. So they have to in that 1:10, you should be like very careful. If you know like information about all the colleges, and if you are very clear about your preferences, there is high chance that you are going to get a seat. For example, as we discussed, why you have to choose a college where you are having more medical colleges in a state. Why you have to choose that state? Because that will help you with the PG preparation. For example, a 50,000 ranker who takes a seat in a state where they're having some 2 to 3 medical colleges, and some 60,000 ranker, he takes a seat where they're having more 50 to 60 medical colleges. Definitely, when it comes to taking a PG seat, the person who is having 60,000 to 70,000 ranker, he will have more options to get a PG seat rather than having a person who had 50,000 rank and he did not take a seat in the state where they had more medical colleges. So these points you may not aware now, you may not be aware of, but these things will definitely matter once you do a MBBS. So, and also the language barrier. See, you are doing a course which is of 5.5 years, which is a long course. So you have to learn the language. So just be open minded. Don't think that I'll just go and finish my course and come back. It is not like that, because it is a 5.5 years course. You are going to interact with the patient, you are going to learn with the patient, and it is like you're all naive now. You are entering as a student, but once you complete the course, you will come out as a doctor, you will come out as a profession, like so that's why you just be open minded. Whatever the state, whatever the seat you are getting, wherever you are getting, wherever the state you are joining, just be open minded that you are going to learn that language. It is not very difficult, because the person who has cracked seat of MBBS, who has come out in the 1:20 ratio, it is not very difficult to learn a language. And also the patient load matters a lot here, because the colleges, especially the old colleges, which are there like more than 10 years, 20 years, 30 years, there are colleges which are there since 100 years also. There are a few colleges in India. So here they are so reputed, the patient load is so high, you'll get to see cases, whatever they mention in the textbook, you'll get to see all sorts of cases. So your experience, your exposure in MBBS will be very good, so that you will have your basics will be strong, so that you will have a very good hold in your practice in future also. So these are the things you should keep in mind while choosing a college leader. Yes.
Yeah, thank you, ma'am. That was very insightful. In just you covered all the subcomponents of how to make a exact choice filling order particular to these components. Yeah, thank you. So we do have Dr. Syed here, who has completed from KMC Manipal. His exposure and your opinion on KMC Manipal, a little bit about other deemed and private institute as well. How much difference does it make?
Thank you very much, Dr. Sridhar, for giving me this opportunity. Yes, I am a proud alumni of Kasturba Medical College, Manipal, which I can say proudly that it has ranked almost top 5 consistently in the last 10 to 15 years. And one of the greatest phases of my life was that 5.5 years that I've spent in my college. And yes, it has been a joyride. I have faced challenges, I have faced achievements, accomplishments. It has built my character. It has changed a lot of things in life. And not just me, any person who has joined a medical college as a person who is, he will come out as a different person from any medical college that he has gone. Now let's focus on what deemed medical colleges have to offer. Something with that name, the popularity of KMC Manipal is gigantic. I'm not saying just to boast or promote that thing, but it is very true because the name Manipal rings with majesty. You have a lot of exposure during academics. Academics is topmost in that medical colleges as of what I have seen. And one of the most highlighting features, there's something called anatomy physiology museums that help in better studies, and there are a lot of activities that is going on that helps in academics and your other aspects of life, like character development programs. And you have an amazing library that is Asia's number 2 largest library in KMC Manipal, which you will interact with different students of different nationalities in different regions. Yes, I am very proud to say that I'm from that place.
Thank you.
Now,
Thank you,
let's
Dr.
see.
Thank you, Dr. Sayed.
Yeah, I would like to add one more thing regarding that deemed university. The academics will be of prime importance. What I have seen is academics will be of prime importance, and you will be nurtured and practically spoon fed with academics, which will help you in long term in your career.
Yeah,
Thank
you.
you.
Little bit of seeing things. It was very insightful to hear that. Little bit of seeing things little on other side. I would like to call Dr. Wasim, who completed from a well-known government institute in a different state of UG, then PG in a different state, then consultant in a different place. So multi-state influence is there. Your medical training is there. So exposure with multiple people, and you have been a faculty for UG also. So what is your opinion, sir, on choosing a college, and how much does it matter? Because each and every candidate, the career or the background depends.
Yeah, Dr. Shreedhar, thank you. See, I did my MBBS from Sri Venkateshwara Medical College, Tirupati, from Andhra Pradesh. It is a government medical college. It is almost 60-year-old medical college. So it is one of the oldest medical colleges in Andhra Pradesh. So I took that medical college because in my rank I had an opportunity. I was a native of Andhra Pradesh, Tirupati as well. So I got an opportunity to study there, as well as I was aware that I would get an opportunity for more PG seats as well, because there are a lot of medical colleges in Andhra Pradesh, as I have already seen in the list. So based on that, like how Dr. Pallav Madam has already told, popularity, state, language, city, and the domicile, and all these things matters. So that's how we have almost like one of the things which we consider while we're getting into the MBBS. So I did my MBBS from Andhra Pradesh. Then I did my post graduation from Karnataka. So I went through the All India counseling, and then I entered into Karnataka. I did my post graduation there. Like how Pallav ma'am has told, for a student or for a doctor who is doing who is becoming a doctor or who is doing his MBBS, it doesn't matter to what you say, learn a new language. It's always efforts, learning new things. See, gaining knowledge is a continuous process of our life. When you try to learn something, it will boost your confidence. It will what you say, it will the way you interact with the people, the amount of knowledge you gain, it improves. So being from Andhra Pradesh, I did my post graduation in Karnataka. I learned Kannada as well when I came here. So and then and now I'm working as a faculty in one of the medical colleges. Yes, I have seen. I did my MBBS from government medical college, and then I have seen the private medical colleges as well. How the things go on. So the main how Dr. Sami has already explained to you about how deemed universities are there. I would like to just put a note on how government medical colleges as well. See, the government medical colleges, the names speak for themselves. Like we do have Dr. Sridhar here. He's from Stanley Medical College, where the name itself speaks for it. So similarly, we do have Madras Medical Colleges. We have Bangalore Medical College in Karnataka. These are old medical colleges which speak for themselves. So in these medical colleges, because they have been there for a long period, or they are almost 100 years old, the patient load is adequate. It means like how Dr. Pallavi ma'am has already explained, you get to see almost all the cases in the textbook. So it is a very important thing. There you get to see a lot of patient exposure, a lot of patient load. That is very important. See, MBBS doesn't mean that you sit down and read all the books, write the exam, you come out as a doctor. It doesn't happen like that. Because at the end, now Government of India, along with Medical Council, has also emphasized on the early exposure to the clinical postings as well. So they have started to introduce students to the clinical postings very early. So even in the first year, they want to tune the students to get into clinical exposure. Like they want the students to go to the wards, go to the OPDs of the clinical departments, go there and interact with the faculty, how the things are going on in that particular department. So this is what we call as early exposure to the clinical rotation posting. So that is emphasis and need of the hour as well. So that thing in a government medical college, yes, it is there. So it will be there. And academics, see, whatever it is there, you have to work on your hard as well. You have to study. You have material, you have adequate material with you. Never feel down that I am from this college, that college. Books are there with you. Patients are your best teachers. Always remember, whatever you are learning in your MBBS course, you are learning from your patients. Try to understand that whatever you are studying from your books, you go back and learn from your patients, and then you come back and apply your clinical knowledge. So always it is like what the mind doesn't know, the eyes cannot see. So it is very important to keep all these things into picture, and then you can go forward. Over to you, Dr. Sridhar.
Yeah. In gist, if you want to put everything, the bottom line is that whenever you're choosing a particular course, particular college for UG in a particular state, you should be an informed decision on each and every choice filling order. It is not a blind, because that determines your exact course of your life, where it goes. So moving forward with the MBBS course timelines, you could see in the screen from RGUHS of how the scheduling of MBBS is. Because we know there are few colleges which have been recently started and a few of the departments are coming up and it is getting developed. We also know that there are many colleges which are old enough to know all super specialty subjects are there. So if you are going to a college which having much of the infrastructure, and if you have the data with you, like these all there, then the exposure to the one particular field and the habit of developing interest over the field and determining your post-graduation and super specialty is more when compared to the other colleges which is lacking infrastructure or it is in the developmental phase. And we should also be practical that exam is over for you, NEET UG, and rank is there at your end, category or reservation or quota is there at your end. That is also there at your end. Now, it is the knowledge or the idea of the college you are joining matters more when in the counseling process. Moving little bit about the MBBS course individual year-wise, I would like to call Dr. Pallavi Madam to explain in gist about the first MBBS professional courses. Yeah, you might think it might be little too early to assess this because just now you are immediately out of your PUC or your 12th and you are preparing for exam. But this is your life. Even if you are avoiding, then you are entered into the stream. Then till your life, this MBBS, post graduation, super specialty, and medical curriculum is our mantra for us. So we'll start right away from here. And what difference does it makes to choose a college? And you can also give a comparative. You can ask the panelists, Dr. Wasim and Dr. Syed also, to give your inputs related to the government colleges as well as for the private or deemed institute. How does it matter and how it will be there? We should want to give, because before choosing a college, people should get knowledge and data as much as possible before making that informed decision. So we'll start with the first year professional MBBS, and we'll already, it is like time, but we'll try to complete all the 5 years as well. Yeah, over to you, Dr. Pallavi ma'am. Yeah, can you hear me, ma'am? Dr. Pallavi ma'am? I think there is a delay on our end. Okay, Dr. Wasim sir, can you take it over?
Yeah, Dr. Sridhar. Yeah, actually, because the time is limited and MBBS is a course which extends over 5.5 years and you have a lot of subjects in that. So right now we'll focus on something first professional MBBS. Okay, here you can see on the slide
Yes.
distribution of subjects.
As we said, as we saw, like it is like a
Sorry.
phase last slide. In the why early start is the best. At least you should get subjects you are going to study, because till 12th. Yeah. Either I can hear you.
Dr. Pallavi, ma'am, am I audible? Yeah, Dr. Sridhar, I think there is a bit of delay, audio delay.
Yes,
It's not a big issue.
Wasim, you're audible.
If you are fine, you can continue, ma'am. Yeah, ma'am.
Am I audible now, or there is any delay?
Ma'am, you are audible, ma'am. Please continue, ma'am.
Yeah, okay. In the first year, there are subjects like anatomy, physiology, and biochemistry. We will just tell like a just what exactly is anatomy, what exactly is physiology, and because these are the subjects which are very new, which you have not studied before till yet. For example, what you think a doctor means, they will treat the disease. If you know what is the disease, first you should know what is normal. So what the normal things you are going to study in the first year. So first year of your MBBS. Anatomy, you will study like if it is a hand, what exactly it is inside the hand, muscles. There are so many.
I think that was a technical issue. No issue. I think Dr. Wasim can proceed with this.
See, like Dr. Pallavi madam was trying to explain, so basically a disease is something which has deviated from the normal process of how the human body is made. So basically in first year, what you are going to learn is you are going to learn the fundamentals of human body. So there you have human anatomy, physiology, and biochemistry. So anatomy is how the human body is made, all the muscles, be it bones, how the joints are made, what and all the structures are there in the human body, and then physiology, how these structures which are anatomically present in our body, they try to function with each other. So that is what you call as the interlinking between the systems. We do have a respiratory system where the lungs are considered, cardiovascular system where heart is there. We have central nervous system where the brain is considered, and gastrointestinal system where you have stomach and intestines as well. So all these things in anatomy you will get to know what and all are there. In physiology you will read how they function from the cellular level to the macroscopic level, what and all happens in those organs. So that is how human physiology. And human biochemistry is basically related with what and all the biochemical parameters happen. Like for example, thyroid gland is in the neck, it releases thyroid hormones. So you study about all those things in biochemistry as well, and you get to do few investigations, you get to do few blood tests, you get to do few investigations will which will try to bring out, or which will try to let us know what is wrong with the patient. Like for example, if there is any deviation from the normal condition, like for example, if a normal patient gives his urine for investigation, that doesn't have sugar in it, but in a biochemistry test, if you do a urine analysis, if you get sugar there, you are going to tell, yes, this patient can have diabetes. So that is how the importance of the basis of the first year goes, because anatomy, physiology, and biochemistry are blended in such a way that you are going to get the fundamentals of a human body in the very first year itself. And,
Thank you.
And yeah, Dr. Sridhar,
Yeah,
actually, I'd just like to add the small point on the last thing, the attitude, ethics, and communication module, 8Com module. It has been introduced recently. When we were studying, it was just like a specific seminar or conference where they used to tell us. But now this module has been introduced and incorporated into the syllabus as well, where the students are being taught how to maintain professional ethics, how to maintain few etiquettes, how to communicate with the patients, how to communicate among themselves, like how to communicate with a fellow doctor, your colleagues, how to communicate with health professionals, higher officials, and all those things. So that thing is additionally added here. Yeah, over to you, Dr. Sridhar.
Yeah, thank you, sir. So you have told a little bit about what anatomy, physiology, all the teaching elements pertaining to the professional course. Now, choosing a college, what difference does it make to see whether the college is adequate enough to have all these structures? In contrary, seeing them in the government colleges as well as the private and deemed institute. Now, I would like to ask Dr. Syed to give his opinion on this. What difference does it
Thank
make
you.
on choice filling? Yeah.
Yeah, thank you, Dr. Sridhar. And I very well understand the need of the hour of choosing a college where all the subjects have been taught properly and all the concepts of the particular subjects has been understood by the particular individual. So what I would say is, at least from where I have studied and what I have got a feedback from the deemed universities, is that academics has always been the prime concern. So if we see the first year subjects like human anatomy, like Wasim sir told, it's all about the structure of the normal human body, where you're allowed to dissect the particular cadaver, that is body, they will be provided, and all the teachers will be helping you in how to dissect it. You will be able to cut the ligaments and what are the structures. And in physiology, there will be multiple labs where you will be able to experiment, and you'll be able to experiment on different frog muscles and all the aspects which you will learn after you join the colleges. And biochemistry, again, what Wasim sir told, is more about the biochemical aspects, that is the blood, the urine, and other secretions from the body related issues. Now, what I'm most importantly says, deemed university, especially from the place where I have studied, have been spoon fed the students of the academics and the experimentation. And one more thing is, best thing is abroad, what do you say, experience. How these subjects have been taught abroad outside India, like USA or UK or Australia or Ireland, how these subjects have been taught has also been incorporated, has been seen in a good way. So in deemed university, these are the advantages. And again, the things related to humanities and ethics, they'll be having certain sessions which will be conducted. Where way before, when I was doing my MBBS, we had sessions with fellow doctors, with fellow colleagues of mine, and my seniors and teachers, where we used to sit down and give a scenario, and particular aspects of ethics have been discussed. So these kind of academic sessions have been evolved in deemed universities. Thank you. Over to you, Sridhar.
Yeah, thank you, Said. You told a bit about how that influence of first year subjects also matters in choosing a college. Since the broad say view, people will say it is good, this college is good, that college is good. But there are 19 subjects, below that so many subjects and allied subjects to learn in MBBS. Whether the college you are joining is equipped with all these components, that matters the most. So we will try to spot it each and everything year wise and give you a bird's eye view of what is happening. In the meantime, you can always connect with us in the www.neetpredictor.info, where you can drop. So whatever the live session, don't miss those live sessions. And always the chat box is live over here. You can drop the questions, and we will also have the participants to join over in a few times once the counseling starts. So that gives a better edge over to you. Now we will like to wind up the session by just commenting on this, the transition from the school to college and the need for counseling.
I would like to add one more thing, Dr. Sridhar, here. Like most of the students who have finished their 12th standard, they'll be out of the exam phase right now, and they want to like spend their time enjoying for that time. Yes, it is there. You will get your time to enjoy in the college also. So what you have to do is you have to plan your enjoyment. My colleague or my senior used to always tell, failing to plan is planning to fail. So you'll always have to plan it in such a way where you enjoy, where you learn, and where you complete your life in a very nice manner.
Yeah, that was very insightful, Dr. Syed, the way you told and put the things in perspective. Because everything matters. Everything matters at the end. Exactly. Dr. Wasim, sir, your thought on this?
Yeah, Dr. Sridhar, like how Dr. Sami has explained, he has explained the perspective. Like enjoy whatever you are doing. Okay, so now that you have finished your +1 and +2, now you are transitioning yourself from school to college. Now this is a professional college. Okay, it's a professional medical college where you enter as a student and then you come out as a professional. You are going to come out as a responsible citizen of the country. So you are in a prestigious and you are in a very most valuable profession called as doctor, where you have to deal with lives in and out. So every day you have to deal with the patients and the lives very closely. So no other profession deals with the life so closely. So the transition, yes, the transition happens. People in first year when they come, they get scared. Oh my God, what is going to happen? And they go to anatomy hall, they see cadaver and they get fainted as well. Don't worry, nothing. It takes time to get adjusted. Don't get tensed about anything. Whatever situation you are now, your colleagues are also there, and we all have come out from that phase as well. So always try to learn new things. Try to get accustomed to the environment. That's how you get to accustom yourself to the new things in the life. When you keep learning, your confidence increases. Okay, nothing. Everything can be done. Okay, everything has already been done by your seniors, and yes, you also can achieve. And now the need for counseling guidance is very important, like how I have told you. Over the session we have discussed what are all the factors are important, because where you are going to do your mbbs is very very important. Be it academics, be it the colleagues you are getting, be it the place where you are going to get the adequate clinical material, be it where the patient load, be it the anatomy hall, dissection halls, physiology labs, be it biochemistry labs, wherever there is good infrastructure and good patient load. If you learn from there, you will always have an extra edge and you will reach a place where you will be able to do justice for your whatever you are going to study in that particular field. So I think Dr. Sridhar, I think Mr. Kumar Madhavji can explain here the very important, because this is a very important thing. You have got a rank, now you have to customize it in a such a way and take a proper guidance and that land up in a very good college where you are going to spend your 5.5 years further. And over the sessions we will discuss about the other important aspects as well. Please stay tuned to us, subscribe to our channel, and please visit www.neetpredictor.info as well. Over to you, Dr. Sridhar. Yeah.
Yeah, thank you, Dr. Wasim. So, little bit to put a fact here. When we compare the NEET UG undergraduate, when compared to the NEET PG people are exposed when they put so many options all over the country. Even they will try to put out of the country using the USMLE and PLAB thing. But when we see the contrary to the NEET UG, people restrict themselves to their domicile state of their native language barrier, even the family circle. So these things are all there. So what is your opinion, Mr. Madhavji, on how best it can be utilized for UG and the need for counseling guidance for them?
See, actually, for PG, like most of the candidates or as their parents, they're aware. So, but for UG, candidates or as their parents, if they don't belong to this medico family, so they're not aware with this process and all. So, which college they have to opt? Like, for example, few candidates, they are very much confused and they don't know about the process and all. If they're not able to get this government college, then what will be their second option? If they don't have their if they don't have medical college, private medical college over their state, then what are the other options? So few candidates by doing some mistakes and all, they're opting for deemed university with high fees, but they're not aware of other state low fees colleges. For example, like few states, they're having very good colleges with less fees, like Karnataka. Karnataka, they're charging around 10 lakhs fees per annum for other state candidates. So it's a very good opportunity to enter into the private colleges. So you have to be very much aware, based on your rank, whichever possible options are there. And apart from government colleges, which all private colleges, you must go for it, and you have to see the bond factors and all. So and apart from this, lots of factors you have to see, like the academic, medical PG benefits, and lots of factors are there. So apart from this, we do have a premium package as well, where we are giving complete guidance for this medical UG, as well as we have done lots of successful allotment in PG and super specialty counseling from past few years. Even though like we have done very good allotment in NEET UG counseling as well. So in this package, like first of all, candidate they must know based on his or her rank which college they can get, and so we are giving one kind of personal mapping based on her score or rank and category, which all colleges or else which all state counseling or all India counseling they must apply, and which all colleges are possible. And apart from this, like we are helping them in making the plan, so how to work out, because right now apart from all India counseling, the state counseling dates also like has been came. Like you will see Punjab state counseling, they already started, and 7 to 13th is the last date. 13th is the last date for registration. Gujarat, they already started. Jharkhand, they already started. Jammu Kashmir, they already started. Rajasthan, they are going to start from 13th of October. Madhya Pradesh, 12th to 20th of October. So these are the state counseling. Few states are open state like MP, Rajasthan, Punjab, those are open states. So other state candidate can apply for private seat as well. So we are giving complete guidance that where you can apply and how to take that seat. And apart from this, we are also helping candidate in like getting the other information, important information like bond details, fees, seat leaving penalty, which institute they should avoid. See, like and hands-on patient load, lots of accommodation details. Is there any hidden charge? Few colleges over India, I don't want to name those colleges. They are charging like 3 to 5 lakhs hidden charges as miscellaneous charges. So you must avoid those colleges. So we do have complete data of all those colleges, and few candidates like they are like from different part of India, so they might face some language barrier, or else like they might face some like food problem, because North Indian, like if they're coming to our South India, then definitely they are going to face some language barrier. Apart from this, food issue is there. So we do have all those data, and we are guiding throughout this process. So if like some student or parents they are interested, then they can join us. So these are our testimonials. So we did very tremendous job from past few years. So we are getting very good like references, and we are very good in this counseling guidance. So you must join us for better guidance.
Yeah, thank you, Madhavji. I think today it was a very fruitful evening for everyone who has joined. So much of information should be gained. It is not just about just giving a promotion or a product. It is just these are all the things available right to you in front of you, and that is the practical and real life scenario. So take your informed decision in whatever you do. So stay tuned and stay updated.
And one more thing, like I want to add one important thing. Like, see, we are giving some special service. Like, we are directly, like, personally, me and my team, like, we are helping them in doing the registration process, and apart from this, choice filling. So that is the special thing we are giving. So based on their rank, how to do the registration. Like, for example, some candidate, he or she want to apply for Karnataka or All India Counseling. So like we do have a panel, we do have a team of experts. So they are doing personally, like they are filling the registration form, they are uploading the documents, and we are only filling the choice filling order based on their personal preference and based on the order. So it's very helpful. Means it's a kind of errorless counseling. If some expert is doing in behalf of a student, then few times what happen, like a student, they are not aware of this thing. So they might get disqualified if they are doing some mistake in registration or choice filling. They might get some wrong college. So expert team personally, they are doing this thing for them. So it's very helpful.
Yeah. So stay tuned and subscribe to our channel and see all the previous videos. And always don't forget to visit the website www.neetpredictor.info. So thank you once again, everyone, for joining the session and giving me opportunity to moderate, and NEET Predictor team and the Mednucleus team for making this event a successful one. Thank you.